I could tell you from third grade, I was like, I was going to be a kid's doctor. That's what I had always thought. I really loved my pediatrician. And then in high school, I took an AP psychology course. And I was just fascinated with how the brain worked and why people do what they do and how to be a support for others in that sense, in their emotional needs and their psychological needs. Chronic pain is my main bucket, but I also take on long-term anxiety cases. First visits, I always start off by saying, like, this is kind of a get to know you. And I try to be as open with my patients as possible because I'm asking them, and I'll tell them, this is the start of a visit where I'm asking you like thousands of questions, so just bear with me. I try to be open with myself as well because you want to be able to know who your provider is. You want to be able to feel comfortable asking your own questions. One of the biggest pieces in terms of working with me is that this is treatment that is individualized for you. I want my patients to feel empowered to be a part of this process. It's collaborative. I am somebody who is trying to walk along with you in this journey. I may have suggestions, right? I'm going to have some skills for you to work on, and I'm going to have some evidence-based practices that I find to be helpful for whatever condition that we're dealing with at the time. And in that same breath, you are a part of this process, so you get a lot of say in how this goes, and I want them to feel empowered to be able to do that with me. I come together with the child and their parents to kind of go over my recommendations and what we do moving forward. There was somebody who we call them graduations when they graduate from pain program. So they've completed all 3 weeks of pain program, and it's very exciting. And she wrote me a thank you note. And one thing that stuck out to me that, oh gosh, makes me feel a little emotional is just like she feels like she gets to be herself again. The most rewarding thing that you could ever give to me is the fact that I get to be a part of your journey into feeling more like you. And at a time where she didn't really feel like that, right? Like pain was kind of taking over her life. And now she feels like she is so much more than her condition, or she is so much more than her pain. And that was really something special.